Hi, Dr. Aditya here, back with part 2 of the session that we had begun last week. So in the last week, we discussed about few of the most important suture materials, and it included the most important, the holy grail of OBGY, that happens to be Vicryl. We discussed about Vicryl, Vicryl Rapid, Vicryl Plus. So go back and see those videos. I have also discussed what all things do they mention on the packet of your suture materials. Very important for you to know that, because in the exam, if you have not studied any suture, you can easily look on it and answer. So I've taught that in the last session. I have also discussed the difference between Merceline and Merisilk, and yeah, so these are all the sutures that I discussed. So in today's session, I'm going to be discussing something that used to be one of the most commonly used sutures, and that was catgut or chromic catgut. Apart from that, I'm going to be discussing about Proline, that is polypropylene, Monocryl, Ethylon, linen, stapler, and lastly Stratafix, which happens to be one of the more recent ones, that is a barb suture. So beginning without further ado, the first suture that I have, of course, it is going to be chromic catgut. Now I'm going to be discussing it in the same pattern that I did for the previous sutures. So I'll be opening it at the end because there's a reason to it. You can see that this has a very squishy feel to it. Why is there a squishy feel? I feel that there is something inside. Is it air? No, it doesn't feel like air. There is something in that. Something is isopropyl alcohol. Sometimes it can even be glycerol, but it is anything but water. So one thing, the most important thing that you have to remember is when you open this packet, some fluid falls out of it. That is absolutely fine, but do not. Staff nurses, sisters, and even surgeons have this habit of taking the suture, like I'm going to take this Vicryl, and they put it, after removing it from the packet, they put it and drab it through either gel like lignocaine jelly or just plain jelly, or through water. You do not need to do that. Do not touch water or normal saline to it, because that is going to initiate the degradation process of this material. Directly start using it, which is why that alcohol is going to preserve it. So what it is made from? Cat gut. Gut is intestine. So this was actually made not from cats, but from the submucosal tissue of bovine or person, that is from cattle or pigs. And earlier it was plain catgut, now it is chromic catgut because they have added chromium salts to it. So this happens to be chromic catgut. You can see the name over here, it is written, it is chromic catgut. What is it? It is given that it is a round body, again half circle. 40 millimeters is the length of the needle, you can see over here, and the total length of the suture over here, it is given to be 76 centimeters. So this is from Lotus company, it is not of Ethicon. Apart from that, this is the number 0 Vicryl, and yeah, rest of the information is given over here. It was earlier used for everything, but now it is not used. The reason being, plain catgut has an absorption time of around 20 to 30 days, whereas or rather a little more, not 20 to 30, 40 to 50 days, whereas the chromic catgut has around 60 to 70 days absorption, but it gets, or it loses 50% of its strength within 10 to 14 days, this chromic catgut, whereas the plain catgut lost its strength within 5 to 7 days. So it was a very far from ideal suture for uterine closure. People do still use it, it is still effective, but you have a better alternative now. The only reason why this can still be used is because it is very cheap. This hardly costs around 150 rupees, very cheap in comparison to Vicryl that used to cost me 610 rupees, so cheaper. So when I open it, you will see that some fluid is going to fall out from it. See, some fluid just fell out from it. This was that fluid that I was talking about. So see, it is soaked in that fluid, it is completely wet, and when I remove it, you will see that it contains, I have to literally peel off everything. Yeah, I removed it. This is still wet, and 50 this is of 50%, as half a circle. So this is an absorbable, natural, multi-filament, but not braided like Vicryl. This is just multi-filament twisted kind of suture material. So remember that this is absorbable, natural, and it is multi-filament, but unfortunately, because it is just twisted, it is not that strong and it can easily break. In fact, you try to pull it, it is going to break easily. So it doesn't have a good knot memory, as they call it, or a knot strength, as they call it. So all in all, an okay suture, I would want to give it nothing more than 6 on 10, and in fact the plain catgut is not going to get anything more than 3 on 10 from me. Okay suture, good suture, I can use it for rectus muscle closure, I can still use it for peritoneal closure, but I would not want to use it for uterine closure. Maybe for some hemostatic sutures, yes, we can still use it because it is going to have not much of a drag. But remember, because it is a natural suture, it is derived from animal source, it has a very high reactivity. Tissue reactivity is very high, and whenever tissue reactivity is high, it is going to lead to post-operative pain as well and inflammation. So remember that very well. So that was about chromic catgut. The next one that I pick up is going to be this Monocryl. Monocryl is going to be the next suture that I pick up. Monocryl is, you might say, the thinner version of Vicryl. No, the materials are completely different. Vicryl had polyglactone 910, whereas this is going to have polyglycaprone 25. So polyglycaprone 25, this is again a synthetic suture. You see, this is a synthetic suture, and this is again absorbable. It is very, very thin. This is a 30. 30 is one of the thinner sutures that I have today with me. If I break it open for you, I'm not even going to be able to show you how thin it is. It is that thin. You see, it is literally so thin. In fact, while pulling it out, it has given away. So yeah, it is so thin. I am pretty sure I'm not going to be able to show it to you. Very thin. You see, very thin. And hence it is used most importantly for, the most important use of it is going to be for suturing of the skin. Because it's a monofilament suture, it does not have strength, it will break very easily, and because it breaks very easily, you cannot really use it. I'm just trying to show you, it is very thin. I won't be able, it is literally as thin as my hair, strand of hair. Very good for cosmesis, but very poor strength. In fact, it loses all its strength within 3 to 4 days, but it still stays in there in some amounts for almost 90 to 120 days. So though the strength is lost, it will still stay there, and hence it is going to get absorbed completely in a very aram se pattern around 100 days ke baad, but it will lose all its strength. So the only use that I can see of it is for closing of the skin site and in subcuticular pattern, amazing cosmesis, or for closing of the trocar site whenever you have inserted your ports in gynae laparoscopy. Apart from that, only cosmesis suture, I would want to give it 7 on 10 because it gives the female a great cosmetic outcome, but apart from that, no real utility of this suture material, Monocryl. So monofilament, absorbable, synthetic material. The next that I have with me is going to be, what should I open up for you? So the next one that I open up for you is going to be this one, Ethylon. So Ethylon is the next suture that I've pulled out for you. So Ethylon actually is nylon. So this is Ethylon and this is the thread. So what I have with me right now is actually loop Ethylon. You see that there is a loop that is there behind it. You also get a single suture, a single thread suture. So this is loop Ethylon. It is going to be black in color, and this black color is going to have, as I can show you, this over here you can see, it is often going to have reverse cutting or circular or round body needle because it has to go through tissues like the skin, which are very tough, which are very tense. So it has to go through it. So it is going to have cutting or reverse cutting kind of a body. Where do I use it? There are two real places where I can use it, mainly where I use it regularly. The first is of course skin, when I have to close it. In the skin, I can do it through subcuticular as well as for vertical mattress. Another place where a lot of people still use it is in previous LSES patients for closing the rectus sheath. It is not something that I really approve of because that can lead to post-operative scar site pain, especially at the ends where you have taken a knot. So the patient, especially lean patients, can feel it through their skin, and in fact that can lead to pain and small granuloma, foreign body granuloma in that location, which will require resection later on. Apart from this, this is also very useful suture because it is used for cervical stitch, that is your encerclage, and a few people even still use it for that. It is something that was used in my institution. I've used it prolifically, so very important suture material for that. Apart from that, whenever I'm doing Purandare's cervicopexy, whenever I'm using this suture material, that was Mercilin tape. This Mercilin tape used to be attached at the rectus sheath in Purandare cervicopexy using the Ethylon suture material. So this happens to be, if I'm going to be talking about just a single thread of it and not the loop, it is going to be a monofilament synthetic permanent suture material. It is non-absorbable. It is a permanent suture material that will stay throughout the life with this female. It is not going to get absorbed at all. So I was just trying to see if I have Ethylon, if I have any other Ethylon, but I think the other one also that I have happens to be the same loop Ethylon. Loop Ethylon, nothing, just it helps in suturing it without taking any knot on it, nothing more than that. So how do I rate it? I shall give it a solid 7 on 10 again, because very useful, very tense, it keeps the skin together. It can even be used in bad wound dehiscence, post wound dehiscence for en masse closure. What is en masse closure? Basically when I'm taking the subcute as well as the skin together. So it has a lot of strength in it, but it is monofilament. Do not use too much of strength because it can still break occasionally and doesn't have too much of a reaction. So permanent suture, glides very easily, 7 on 10. Ethylon, that is nylon. The next that I'm going to be talking about happens to be my stapler. Now stapler is simply stainless steel, and this stainless steel, basically if I'm going to look at it like this, synthetic, non-absorbable of course, and I would want to call it monofilament. So how do I use it? So you see over here the pins are loaded. You can see over here the pins are loaded inside. So I'm going to put it on the suture site and I'm just going to show you an example. I have removed one pin from it, and this pin you can see over here, this literally looks like your usual pin that you use for stapling. Very good. I had done my thesis on this, on what is better, Ethylon or stapler for suturing of the skin in LSES. I had found that stapler is slightly better, but your results may vary. I love using this a lot. It saves up on my time. The most important thing is that it saves up on my time. Stainless steel here, so it is not going to have any tissue reaction. But remember, you cannot use it anywhere except your skin. Not a single layer apart from that. At least Ethylon could have been used on your rectus sheath, but this cannot be used anywhere. This is a good suture material, but very limited uses, only the skin. Saves me time, but again is expensive. This almost costs me around 1000 rupees. The small stapler cost me 1000 rupees. There's a technique to it. How do I use it? So if imagine this is my wound, so I'll be putting an Alice forceps here, I'll be putting another Alice forceps over here, then I'll be pulling it, and once I pull it, I'll be approximating these two edges. With the tooth forceps, I'm going to be holding these two edges close together so that they are opposing each other properly, and once they're opposed like this, over here you can see that an arrow is made. That arrow is going to be placed over here like this, and I'm going to be pressing it. That arrow has to be proper and this has to be in the center. If you do it like this or like this, then one side is going to get stretched and that can lead to dehiscence. So very good suture, but requires meticulous technique, and you should observe the surgeon who is using it. Do not use it for wounds, the edges where they are too far apart. Avoid using it there. Over there you have to use Ethylon. This is where the edges are coming close very easily. You need of course a different type of suture removal. It looks like a forceps. You need a different kind of a suture removal material for this, so you need to have that as well in your OPD whenever you're using these sutures in your operative theaters. So stapler, 5 on 10. Very limited use, saves my time, but for that time that I'm saving, I'm also paying a hefty amount. So yes, stapler, stainless steel. Now, one historical suture. I will say that though it is historical, it has played a significant role in my learning, and that learning, by learning I intend to say it has helped me a lot in learning how to suture. The grandfather of all sutures, it happens to be the linen. The linen is made up of flax fibers, and अच्छा है, ठीक है, लेकिन nowadays it is not used. Earlier it was used for pedicles and everything. It has very slow delayed absorption, not used much, and it is similar to catgut. It is multi-twisted. Occasionally it can be braided. Very delayed absorbable, I would say, maybe even to the level of permanent, just like silk. And it is of course a natural fiber. It is not used anymore. It is of course very useful for learning hand knots and everything, very very important in that role for surgeons to learn their trade. Historical, only for that historical reason I'll give it a 3 on 10, not used anymore, obsolete. ऑब्सोलीट की बात कर रहा हूँ तो उसका एकदम मॉडर्न वर्जन की भी बात कर देते हैं, समथिंग दैट इज वेरी रिसेंट एंड दैट हैपेंस टू बी Stratafix. Stratafix is the next one, and this Stratafix is going to look a lot like this. Unfortunately, I have used it so much that I have only this much that is remaining. Now, if you look here, you can see that Stratafix is not your usual material. It has some braids on, or barbs on it, not braids, it has barbs on it. Barbs are basically ऐसा pointed structures, जो pointed ऐसे चीजें उससे बाहर आ रही है. I don't know if I can show this to you. Maybe I can just try focusing on it. नहीं होगा, sorry. So yeah, this barbed thing basically, yeah, you can see now, is very classically used in laparoscopic surgery. So this happens to be this one that we have is Stratafix PDS. So polydiaxone से बना हुआ है. You also get monocryl. So because this is polydiaxone, this takes much longer, around 100 days to get absorbed. This is a monofilament suture, absorbable suture है. And the reason that this is a very important suture in laparoscopic surgery is that it does not require any knotting. It does not require any knotting intracorporeal, that is inside the body knotting. All you have to do is you have to take a turn and the knot gets trapped in it. So for closing of the vaginal vault after hysterectomy, or for closure of the uterus after myomectomy, a very important and a very good suture. This is one of the model sutures, and hence I would want to give it a good 8.5 on 10 because very useful. And you have to remember that it has to be driven only in one direction. You cannot pull it in the other direction because those barbs can shear that tissue off, so you do not want it. But a good tissue, a good suture material. It is synthetic, it is absorbable, D-lead absorbable हो बोल सकते हो. Monocryl का है तो थोड़ा जल्दी absorb होगा. And apart from that, it is also a monofilament suture. Remember that it is not multifilament, it is monofilament. Lastly for the day, I have another suture. I began with a perfect suture, that was Vicryl. I'll end with a perfect suture. This happens to be Proline. Proline or polypropylene. This what I have is not Proline. It actually is another brand. Proline is a brand name of Ethylon, of Ethicon, whereas this is polypropylene of another brand. So Proline भी इसको बोलूँगा मैं. This is going to have that classical bright blue look to it. बहुत ही ऐसा brilliant blue look रहने वाला है उसको. You see, ऐसा मस्त ऐसा brilliant blue रहने वाला है. And this is shining. This is shining because it is coated, and this coating is going to help it pass through the tissues very easily. Now this is a permanent suture, very much like your Ethylon, but it has very minimal tissue reaction, so the pain rates are very less, the foreign body granuloma rates are very less. So where do we use it? Very importantly, it can be used for your skin suturing. In a good cosmetic way you can use it. The most important use is going to be in tubal recanalization surgeries, wherein we use 6-0 or 7-0 Proline to do the stitching of tuboplasty. So जब tubal block होता है उसको वापस stitch करने के लिए we need a suture, तभी this suture is very important to be used. Important to know that it requires around 6 to 7 knots. Important याद रखना है. And non-absorbable है, monofilament है. Of course याद रखो ये ऐसा दिखता है. It is monofilament and non-absorbable suture, permanent suture है ये. But with very minimal tissue reactivity, so foreign body granuloma होने के chances बहुत कम है. A very 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 good suture. So remember, I'll be giving it 8.5, 9 on 10 दे देंगे. So that is all for all the sutures that I had, that I've covered. One suture that I didn't bring was PDS, that is polydiaxone. Very good suture, again a lot like Vicryl, very similar features. थोड़ा सा ज़्यादा टिकता है, थोड़ा ज़्यादा delayed उसका absorption है, around 150 to 180 days, 6 months लगता है उसको absorb होने के लिए. But same uses, uterine closure अगर करना है तो उसमें use होगा. So good suture. In fact, that is another suture जिसको मैं 9 on 10 दूंगा, just like I had given to Vicryl. That's all. I've covered all the sutures across these two parts. I hope you liked this session. If you did like it, let me know. I'll be soon commencing my gynae endo sessions. I hope you all join me for them. And apart from that, we have our test series now exclusively for Conceptual OBG subscribers. So do attempt those test series. They are for FET, PDCT and NEET SS. So do attempt them. You want to watch all my previous sessions, they are already there on Conceptual OBG, so do download and subscribe. This is Dr. Aditya signing off. Keep watching Conceptual. Goodbye.